Hi everyone, thank you for joining us today. We're going to give everyone about a minute to get out of the waiting room and into the webinar. So we'll be starting in about a minute. Hi, for those of you just joining, we're just going to wait a minute or two for everybody to get out of the waiting room and into the webinar, and we will be starting shortly. All right, we are going to go ahead and get started. First of all, let me just say thank you to everybody for joining us today. My name is Walker Irving, and I am the Outreach Manager here at CityHealth. Our speakers today will be my colleague Katrina Forrest, who is our new co-executive director at CityHealth. And we have Emily Schwiniger, who's from Smart Growth America, and she will be speaking as well. So next slide. This slide just lays out how to ask a question. So at the end of the remarks, we will take some questions and I will pull those out of the chat box. So please feel free to ask a question as we move through the presentation. To do that, all you have to do is click on the bubble at the bottom, the chat bubble, and put your question there, and we'll save those to the end. If you have a technical question, if you have any kind of technical difficulties, please just raise your hand and we will reach out to you individually. And so now we will hear from my colleague, Katrina Forrest.
Great. Thank you, Walker, and thank you once again to everyone for joining us. As Walker mentioned, I am thrilled to be joined by Emily Schwiniger of Smart Growth America to discuss the importance of Complete Streets policies, highlight the findings of our recent report, and discuss the impact of COVID-19 on the transportation landscape. If we could go to the next slide. So before we dive in, I do just want to give a very brief overview of who we are at CityHealth and what we do. CityHealth is an initiative of the De Beaumont Foundation and Kaiser Permanente, and we work with city leaders in the nation's 40 largest cities to adopt a package of 9 evidence-based policies. We then assess cities on the number and strength of those policies and award them gold, silver, and bronze medals. Additionally, we support our city leaders through the provision of technical assistance and providing model ordinance language. Next slide. So why we're all here today. What is a complete street? There is a great William White quote that says, "The street is the river of the life of a city, the place where we come together, the pathway to the center." I think this quote really speaks to what Complete Streets is all about. It's about an interconnected network that helps support the vibrancy of our communities. At the core, Complete Streets policies are about safety. They require city leaders to really prioritize the needs and safety of all residents, irrespective of age or ability, who use all forms of transportation, to include walking, biking, scooting, public transit, and of course, cars. This image, I think, does a really great job of illustrating how we can transform our roadways through street design and transportation infrastructure. So you can see after Complete Streets policies, there's a crosswalk, there are bike lanes, there are pedestrian walkways, there are traffic calming measures. If we can go to the next slide. So how does CityHealth then assess our cities on the Complete Streets policy? You can see here, this is the scoring matrix that we use. And to earn a bronze medal, a city would need to adopt a Complete Streets policy that requires compliance and expressly accommodates pedestrians, bicyclists, motorists, and public transit vehicles. To earn a silver medal, all of the bronze criteria would need to be in place, as well as the policy would need to explicitly accommodate all ages and explicitly accommodate all abilities. And finally, to earn a gold medal, the policy would need to have both the bronze and silver medal criteria in place, but then also the policy would need to assign a department to oversee the policy's implementation, and the policy would need to require the development of performance measures. Next slide. So as I mentioned at the outset, in partnership with Smart Growth America, last week, CityHealth released its new report on the Complete Streets policy. And there were three key takeaways. The first takeaway is that streets have become increasingly more dangerous. Between 2008 and 2017, drivers struck and killed nearly 50,000 pedestrians, according to a report, Dangerous by Design, that is put out by Smart Growth America. And Emily will speak more to that report's findings. Our report also found that the number of pedestrians killed by cars increased by 35% over the past decade, and that of course pedestrians are not the only roadway users that are at risk. Bicyclists and those relying on micromobility like scooters were also at increased risk. Next slide. The second key takeaway is that the report highlights those roadway users who are most at risk. So the report indicated that the rates of pedestrian deaths are highest in the South and among older adults, people of color, and people walking in low-income communities. There were also two specific age demographics that are most vulnerable. So those between the ages of 10 and 14, and those between the ages of 50 and 69, each now represent 20% of all pedestrian traffic fatalities. The report also noted that there are a number of other forces that are at play in the rise of traffic-related fatalities, and that includes income level, population growth, weather conditions, etc. Next slide. The third and perhaps most important takeaway is that complete streets policies really do benefit cities. So according to the CDC, obesity rates have steadily increased over the last 3 decades, and there is a growing body of evidence to support that complete streets policies really do encourage an active lifestyle, which thereby helps to reduce the risk of obesity. The report also found that obtaining enough physical activity and improving options for residents to move safely and conveniently is a critical way to advance equity. Also, along with the evidence illustrating that complete streets has the ability to fight obesity and inactivity, experts have shown that these laws also make our streets safer. Researchers have found that well-designed streets reduce traffic speeds and in turn cuts the risk of injury for pedestrians and cyclists. And finally, the research has repeatedly shown that walking and biking are good for the economy. Experts have found a net increase in new businesses, an increase to property values, and employment levels in communities that implement projects associated with complete streets policies. Next slide. So how did our cities perform? In the report, you'll note that 36 out of our 40 cities did earn a CityHealth medal for the complete streets policy, with 29 cities earning a gold medal and 7 cities earning a silver medal. Next slide. Here you can see the full list of our cities, and so which cities earn gold, which cities earn silver, as well as cities that have not yet adopted policies strong enough to earn a medal from CityHealth. This chart also highlights where we have seen some progress in cities, so they were able to advance their medal from our previous report in 2018. Next slide. I just want to end on talking about the impact of COVID-19 on the transportation landscape. And so one of the things that we know is that the pandemic really has changed behaviors and ultimately changed how we move about our neighborhoods. One of the biggest things that we've seen is that public transit systems have seen their ridership plummet substantially, and that's a result of many Americans are now working from home, some of which are doing so indefinitely. And public transit systems, as a result of that change, they are now running at a fraction of their capacity. They're offering reduced schedules or limited routes. And as cities are working to reopen, many individuals are fearful of being in crowded spaces and also want to adhere to social distancing guidelines. And public transportation is then not a viable alternative. So they are looking for other ways to move about. And what we know is that if there are not strong complete streets policies in place or the investments in street design and infrastructure, many residents may opt to drive, and that could potentially push traffic congestion to record levels. But despite a lot of the challenges that we are seeing, we've also seen some new opportunities. One of the things that we've seen is nationwide bike sales have doubled. The other thing that we have seen is that in cities that have moved forward with complete streets policies, they've been nimble in being able to respond to the ways in which the pandemic has changed transportation. There are a number of cities that we highlight in our report to include Oakland, Washington, D.C., New York City, and Seattle, which Emily will speak more to in her report. Finally, there is a new, and I shouldn't say new, it's more of a renewed opportunity to focus on the equitable distribution of transportation infrastructure in cities. And so with that, I will end there and pass it over to Emily.
Thank you so much, Katrina. I'm happy to be here. Thank you all for joining us. As I was introduced, I'm Emily Schweniger. I am the Deputy Director of Thriving Communities at Smart Growth America, which is a national nonprofit formed by a community of partners that work within the spheres of transportation, land use, economic development, public health, and equity. And I myself have a strong public health background, and I've been working in public health for over a decade. Next slide, please. So what we do at Smart Growth America is empower communities through technical assistance, advocacy, thought leadership to create livable places, healthy people, and shared prosperity. And we work with elected officials at all levels, real estate developers, chambers of commerce, transportation and urban planning professionals, and residents to improve everyday life of people across the country through better development decisions. The National Complete Streets Coalition promotes the development and implementation of policies and professional practices that ensure streets are safe for people of all ages and abilities, and balances the needs of different modes and supports the local land uses, economies, cultures, and the natural environment. Next slide, please. Katrina started us off with a brief intro into complete streets, and I wanted to dig a little deeper. Usually when people hear the term complete streets, they picture a place with bike lanes, crosswalks, sidewalks, street trees, a street that can be safely shared between people walking, biking, rolling, riding the bus, and driving. But complete streets is not actually about one individual street. We think complete streets is an approach that guides how we make decisions about all of our streets so that we can have a transportation network where, regardless of who you are or how you need or want to travel, you can get there in a safe, reliable, affordable, convenient, and comfortable manner. Complete streets means that decision makers routinely think about all people who use the street, regardless of age, access, ability, or mode of transportation. That means we make decisions for all people, including people walking, biking, rolling, and riding the bus, instead of only for drivers, whenever we make changes to our streets, and not just as one standalone project. Next slide, please. And we believe you can't achieve a complete network by fighting the same uphill battle one project at a time. You achieve it by embedding a complete streets process into all of your decision-making as a matter of routine. Policies pave the way for routine complete streets implementation by calling for important changes to your day-to-day practices. That includes how you design projects and how you measure their success, how you decide which projects to fund and which projects to exempt from complete streets, how and when you engage the community, and much, much more. Next slide, please. As Katrina mentioned, CityHealth's new report uses methods derived from the Complete Streets Ideal Policy Standard, which was created by the National Complete Streets Coalition to ensure that communities of all income levels and ethnicities benefit from complete streets equitably. CityHealth's assessment of complete streets policies first looks at whether a city has a complete streets policy in place. Next slide, please. And so why are complete streets included in CityHealth's package of 9 policy recommendations? Well, fundamentally, complete streets make communities safer and healthier by better protecting everyone who uses the road. Our report, Dangerous by Design, shows the number of people struck and killed by drivers while walking has risen in recent years, reaching levels not seen in nearly 3 decades. And the victims of this traffic violence are disproportionately Black and Native Americans. Next slide, please. And as we dig deeper into the numbers, it's important to recognize how decisions about transportation and housing in the United States have discriminated against and excluded certain groups, especially low-income Black communities and other communities of color. And as a result of unjust transportation decisions, vulnerable populations tend to experience higher risk of negative health impacts associated with transportation, such as being struck and killed while walking at higher rates, being exposed to higher rates of respiratory diseases like asthma from harmful emissions, or having reduced access to key health resources such as healthy foods, healthcare services, and parks within a safe walk of home. Next slide, please. The impacts of dangerous streets are also felt more strongly within low and middle income communities where streets have fewer design features that increase safety, like sidewalks, crosswalks, and street lights. Next slide. Many places make decisions that systematically harm the most vulnerable people in their communities. In some cases, this means leaving behind low-income communities and communities of color, concentrating improvements and investments in wealthier, wider areas that already have infrastructure to support walking and biking. Next slide. Thank you. And this is why CityHealth and the National Complete Streets Coalition are working together to hold cities to policy standards that will make their streets safer and healthier places for everyone in their communities. CityHealth and the National Complete Streets Coalition know that complete streets are a tool that can not only make people safer and impact people's health by giving them opportunities to move and breathe cleaner air, improve the environments they live in, strengthen local economies, and improve access to essential services for people who need them the most. Next slide, please. As part of CityHealth's report, we took an in-depth look at cities across the country and found some interesting work happening, a few of which are highlighted in the report. I recommend you take a look if you haven't already. In the city of Oakland, for example, the city launched a Slow Streets program in April of 2020 in response to the COVID-19 crisis. The city was able to respond to the crisis quickly by using low-cost temporary equipment like traffic cones, traffic barricades, and sandwich boards. Though many were grateful for the slow streets, the city quickly heard from residents that many needed access to essential services and jobs. The city was able to launch the Slow Streets Essential Places program in response, which works to ensure that slow streets will help residents safely walk, bike, or roll to places like grocery stores, food distribution sites, and COVID-19 test sites. Next slide, please. This spring, the city of Seattle, which is also highlighted in the report, announced its Stay Healthy Streets initiative, creating over 20 miles of residential streets closed to motor vehicles. This would not have been possible without a strong complete streets policy framework in place. This is one of the first programs in the country where a city permanently opened its streets to people, limiting traffic on many residential streets to residents and visitors only. Importantly, the city of Seattle was able to identify streets to include in its Stay Healthy Streets initiative through previous public engagement work, and the city plans to continue to seek feedback to ensure it's centering racial equity. Next slide, please. Minneapolis is another example of a city that repurposed streets originally designed for cars, prioritizing public health and active transportation. Their Stay Healthy Streets program was one of the first in the country and connects 20 miles of parkways that had been opened up for people during stay-at-home orders this spring. The city recognized that the short-term improvements built on strong complete streets policy framework could be used to create long-term change. Next slide, please. And we've seen these types of responses all over the country, from cities that have declared bike shops essential services, to bike shares being made free for essential workers, to shifting testing sites from drive-through only to walk-up optional. Everything from transit to curbside management have all been affected by this crisis. And communities of different sizes with different needs have responded in their own ways. You can see on your screen a map of the COVID-19 response in Complete Streets. At the coalition, we've been asking partners, members, to share how their communities have been responding to COVID-19. And we've been mapping the results. So please check it out if you get a chance. I think we'll share the link with you and let us know what's happening with transportation in your community. And finally, next slide. I want to end with a question for everybody. At the National Complete Streets Coalition, we're asking ourselves this question when we look at streets in our communities. Who benefits? We know that historically, many government agencies have not prioritized the well-being of low-income communities and communities of color when making decisions about transportation. We remember that we built our national highway system, sometimes intentionally, to disrupt and disconnect these communities. In the last 6 months, we've all been through a lot, including our public streets. They have alternatively been ghost towns, devoid of non-essential people at the height of stay-at-home orders, and the epicenter of mass protests over the murder of George Floyd and systemic racism in American policing. People trying to keep safe distance while walking or exercising have been forced to flee too narrow sidewalks and compete for road space with cars and SUVs, while many cities are now opening streets up for people to create safe space for socially distanced activities, including outdoor dining, for example. All of this is to say that our streets are changeable. Streets that have been designed first and foremost for cars can and should be redesigned for people. People walking, rolling, scooting, biking, driving, or taking transit. This was true before the pandemic, and this has taken on new importance today. It's a matter of saving lives, improving health, and creating safer, more equitable streets and public spaces. Complete Streets policies are guiding these redesigns in many places and should provide the framework for other cities considering doing the same. And while they're doing this work, we demand that they consider all the time who benefits. Next slide, please. And I just want to thank everyone, especially CityHealth, for their partnership and continued support of Complete Streets. And this is my contact information for anyone who wants to reach out. Please look for us on Twitter. And thank you. I'll hand it back over to Walker and Katrina.
Thank you so much, Emily. We will now move to the question and answer period of the webinar. So again, here's the question, how to ask a question slide. Please put your questions in the chat box and we will read through those questions now for Katrina and Emily to answer. So Katrina, the first question is for you. Would CityHealth rate the policy of a large county? And that question is coming from Gregory Scott.
Awesome. Thanks, Walker. So CityHealth assesses the presence of policies in our cities. However, if there is a county, I'll say it this way, if there is a higher level of government, be it the county or state level, that has adopted a policy, we would credit that county or state with a medal. And by virtue of that higher level of government earning a medal, the city would then also get a medal.
And then Katrina, I'm going to ask you another question that just popped up that's a little bit related to CityHealth and how we award medals. So this is from Alfredo Austin. El Paso is a non-attainment area. This complicates the implementation of road diets due to conformity issues. Is there any other city that has experience coordinating with MPO under non-attainment conditions?
So yes, El Paso is one of our cities that currently does not have a medal. However, I can say there is an active coalition group right now working with city officials in El Paso to move forward with a complete streets policy. And there are lots of folks who have been engaged in those conversations. To my knowledge, they've had sort of their initial coalition meeting over the past couple of weeks. And so that work is progressing. We have been working closely with them. I know that Smart Growth America has also been working closely with the folks in El Paso. So Emily, I don't know if there's anything else that you want to add there.
Thanks. No, Katrina, we've been partnering with them and supporting the coalition that they've built there, which we're really happy to see the work that is happening in the organization. And I know that they just recently had their first coalition meeting, which is really exciting. So we're excited to see what develops.
Great. So Katrina, we have two questions that are quite similar about dedicated funding and the ratio of funding compared to highways and streets, and how that can be considered in assessment. And then also, yeah, it's pretty much the same question. So basically, how can we consider funding when looking at whether a city has complete streets policies? And this person specifically asking about Los Angeles.
Got it. Okay. So, I mean, when you're talking about infrastructure, there's going to have to be a funding component to it. As I said before, CityHealth analyzes the presence of policies. I think the funding piece more so gets toward implementation, but that is an area that we are working to explore, how to better assess whether or not cities are actually moving forward with embedding implementation metrics in their particular policies. And funding is one of the places where that is key. Transportation funding is complicated. There's funding from the state level, from the local level, from the federal level. And often, even if a policy is in place, you don't see that manifest in the real world because it takes time to get those dollars out on the street and then actually get the infrastructure in place. But funding is something that is critical. And as I said, implementation is an area that CityHealth is currently working through how to better embed that across our policy criteria.
Great. Our next question is for Emily. This is from Jerry Saavedra. Can you talk about cities with strong complete streets policies working on slow streets? Does it get them thinking they are addressing the problem without doing a strong complete streets policy?
So, of course, thank you for the question, Jerry. And of course, we would argue that it's better to have a strong complete streets policy in place because it's going to give you the framework that you need to make these decisions as you move forward, instead of making each individual decision based on a limited context and time and space. So it's really like a chicken and an egg question. Now, the thing that could be positive about this and what we're seeing happening across the country is, this changed landscape, COVID-19 crisis, and so the racial inequity, the uprising recognition of systemic racism, I think opened a lot of eyes and made people a lot more aware of what's happening on our streets. And so there might be some intermediate steps that communities are taking in order to respond to the immediate crisis that could lead them, and we would want them to get to that strong complete streets policy, because as I said before in my presentation, it's an approach. And so we don't want it to be limited to one time and place, for example, responding to this immediate moment in crisis. We want it to be an approach that, as we know, infrastructure like that required by complete streets can be, light and easy if it's, I showed some pictures from Oakland where, it's just traffic cones or a couple of sandwich boards, but we know that infrastructure long-term can cost a lot of money and take a long time. So we would be happy and celebrate communities that are using these types of interventions, approaches, but we would argue that a complete streets policy and that framework is going to be necessary in order to make sure that you hit all of your sort of key targets around complete street networks throughout the community, and making sure that it's not a temporary solution to a temporary problem, but rather looking at the bigger picture of what we're dealing with across this country. Thank you.
Yeah. So we have a couple of questions about equity in complete streets policies. So the first one is from Daniel Church in Dallas, Texas. He says, in terms of improved infrastructure in wealthier, whiter neighborhoods, is it a matter of these neighborhoods, especially reinvested urban neighborhoods, following infrastructure improvements such as bike lanes and complete streets? Or is it a matter of these communities being better able to exert their voices at City Hall. And then relatedly, there was a question, how can cities measure their current states of equity in transportation and complete streets?
So I'll speak to the first part of the question. I think it's a matter of both. So I think the starting point for cities need to be an accounting and understanding of where they have prioritized investments in complete streets policies. So really looking at their neighborhoods and figuring out, okay, where have we made investments? Where have we not? I think the other key piece of that is community engagement. Elected officials should know what it is that communities want or need. They need to talk to them, because it may be that a city doesn't, or a particular neighborhood doesn't necessarily need more bike lanes. What they need are crosswalks or other traffic calming measures or street lights. And without that direct engagement, they may not know. And so I think it's a combination of both engaging the community, but also having some data to suggest where they should be making critical investments in street design and infrastructure.
And I would add, a lot of that can be done in the process of project selection. And so through a strong complete streets policy framework, there's a time and a place where you really consider what project you're going to do next. And again, speaking to what Katrina just mentioned, the importance of data and understanding essentially the lay of the land, that will help you as a community, as a city government, as a transportation department, decide which project should be invested in accordingly. Of course, engagement is a huge part of the process, and making sure that the community there is on board and part of the first stages of any project, and not a sort of check-in at the end when a project is already through the development process. And of course, what we see a lot of is, the squeaky wheel gets the oil. And so I think making sure and doing that extra work through engagement to have all of those voices at the table, whether it's through strong coalition building, whether it's through the city's own work in outreach and engagement, that those pieces will really support making sure that investments are more equitable moving forward.
Great, thank you. Kimberly Sampson asks, what are the recommendations for trying to rally support from a city? And by city, I mean mayor, council, community members who are more generally concerned with the filling of potholes rather than the overall concept of complete streets, for building a complete streets ordinance. What is considered to be a strong complete streets policy?
It's a great question. So around this idea of rallying support, I think it's understanding who in the advocacy space is working on this, and starting to kind of like grassroots build coalitions around it, building some campaigns around it. Also identifying and prioritizing different communities and neighborhoods where there's been a disinvestment or a lack of investment in street design and transportation infrastructure. And then really just, whether it's writing to your elected official, calling them, sending emails, really kind of building that groundswell support in that way. And in terms of what is considered a complete streets policy, the scoring matrix that I just shared with you, we believe if those specific elements are in place, that makes for a very strong complete streets policy. What I will say is that CityHealth annual or on a 5-year cycle evaluates its policy criteria. We're in the process now of evaluating what are the current best practices and how can we strengthen the criteria that we have in place. And that is a process that we're actually going through with Smart Growth America right now. And so again, the criteria that has just been shared is where we are and what we think does make for a strong complete streets policy. The world has also changed and we recognize that. And so we also want to make sure that we are being adaptive and that our criteria reflects current best practices.
And I would add to what Katrina said, I think that more and more what we see across the country is a deeper understanding of how our streets are connected to all aspects of our lives. And so when I talked about the benefits of complete streets, I think there was a limited view even a decade or 2 decades ago about what streets were for and how they serve their communities. And I think expanding exactly what Katrina said, around advocacy groups, coalition building, making sure that you have strong partners with you will really allow you to shift not only the perspective, but the prerogative of your elected officials or whoever is making decisions around your budget.
Katrina, we have a couple of questions about the size of the cities that CityHealth assesses. What is the minimum population for cities? And what about smaller cities across the country being part of the CityHealth assessment?
Sure. So in terms of minimum size, CityHealth has identified its cities based on US Census data. And so we identified the top 40 largest cities. I believe there was a question about whether or not we support small towns. And so in addition to the work that we do with our big cities, we also have an opt-in program, which is specifically designed for small and mid-size cities, and we assess them across each of our 9 policy areas. And so if there is someone who is wanting support for a smaller or mid-sized city, please reach out to me directly and we can help you get some assistance in drafting a complete streets policy.
Perfect, thank you. So let me see here. Okay, so we have a question from Scott White. In communities that are heavily car-centric, how do you suggest making the case for shifting policies and resources for complete streets, especially when the public believes the DOT narrative that we need to keep adding capacity to our roads and highways?
I can jump in there. We have several reports that I think would be relevant. For example, the congestion con. There's a lot of data that shows that building wider streets is actually creating more congestion, creating more demand for those streets rather than rethinking the way we transport people. And a lot of this has to do with old measures on success. So looking at performance measures, holding transportation departments to new standards, state DOTs. This needs to go all the way up through the federal transportation bill as well. But changing performance standards measures so that we're not just trying to get vehicles through a space in a certain amount of time, but we're actually looking at moving people and moving people in a safe manner. So I think that would do a lot towards changing the way we look at our investments. I think also, there's a lot of evidence, and we've got a few reports on, the economic impacts of complete streets, the local economy, how that can benefit, but I think more importantly, if we look at all of the impacts around a healthier community, more safety, there's evidence there to convince whomever that this is the way of the future.
All right. Our next question is from Brian Ulrich. He asks, we have the political will and the policy is passed, but the implementation is struggling both in the development approval side and the private developer side in recognizing the economic benefits, as both tend to resist the economic costs. Do you have any materials to demonstrate these economic benefits of implementing complete streets policies? Complete streets.
We do, and I will pull up a report that we have where we looked at over 30 different complete streets projects, and we're able to measure the economic impact and found that across all 30, there was an increase to property value, to tax income, etc. So I can share that with you now, Walker, so you can share it with the group.
Okay, perfect. Thank you.
And Walker, we also have some references to that in our report. And so I can pull out the specific endnote so that folks can go directly to those resources.
Okay, great. And we will follow up at the end of the webinar. We will email everybody a link to this recording, and we'll also include some of those resources that we talked about on the call today.
And the report that I referenced is called Safer Streets, Stronger Economies. I'll put it in the chat now.
Great, thank you, Emily. Okay, so David Eagleton says, please explain why it is important to pass a strong complete streets ordinance rather than a complete streets policy, because policies can be left on a shelf to collect dust. So I think that's basically just asking about adopting a policy versus implementation and why it's important to do both.
Yeah, so I will jump in there and say that for me, policy is the foundation of everything. And so without a strong policy in place, it is difficult to hold elected officials accountable. So if you have passed a policy, you can go to them and say, okay, what are you guys doing about this? You've taken the initial step of making sure that this policy is on the books, but now we need to close the gap by making sure we're making the appropriate investments and moving forward with the implementation. But I think it is difficult to make that case when you're still fighting kind of that preliminary battle to even get a policy on the books. So I think it's an enormous accountability tool. The other thing that I will say is CityHealth believes that policy is one of our strongest tools to affect long-term change and improve lives and overall health outcomes. But it is just that, it is a tool. And so I think other things also have to be at play to make sure that city officials are being held accountable and moving forward with making those needed investments.
Okay, great. Here is another question from Gregory Scott. Are there examples of communities that have included electric vehicle infrastructure in their complete streets checklists or policies? So Emily, I think that one's probably for you.
I'm sorry, I didn't hear you. What was that?
Sure. So the question is, are there examples of communities that have included electric vehicle infrastructure in their complete streets checklists and policies?
There are. I can't pull any out offhand, but I'm sure there are.
Okay. And again, we can probably link to something, didn't mean to put you on the spot, Emily, but we can link to something that can answer that question when we send out our follow-up email. Another question about greenhouse gases. It seems a no-brainer that complete streets supports and benefits greenhouse gas emissions reduction and impact on climate change. How can we emphasize this?
Well, we're working actually on a tool with the National Complete Streets Coalition in partnership with the Centers for Disease Control on measuring the benefits of complete streets. And one of the major impact categories is the environment. And through that tool, we're really looking forward to being able to disseminate it across the country and get results back from different communities. It'll be a project level base measurement where we'll be able to see within a project, whether it's an intersection or a corridor, what type of impact their project has. And all of this is pulling down from national data sources around, what types of trees, how many trees can offset what types of emissions, and how much emissions might be reduced by inserting a bike lane, et cetera. So we're really excited about working on having more concrete information around that. But it's certainly something that there's a wealth of information that already exists. But we really want to complete that link and make sure that it's clear that even a small transformation on one block of street can make a difference.
Great. And the same person, Amanda Gatto, also pointed out that there's a New York Times article today saying there's a significant uptick in car sales in New York City in response to the pandemic. So I guess we're seeing that as well.
Yeah, and this is interesting. This is something we've been very concerned about right in the beginning phases of COVID-19. In fact, there was some initial guidance from the CDC that suggested that people should avoid transit which was very alarming. So we've been having a lot of conversations around what safe transit looks like and making sure that this isn't another opportunity for transit to be gutted even further. And, you know, a lot of that has to do with our work on the Hill and making sure that, you know, transit is considered as part of the relief package, because there are a lot of people who don't have the choice to buy that car. You know, this is the same conversation that's happening about, you know, how cities are going to be depopulated. There are a lot of people who have no choice to leave that city. So, you know, this is an interesting phenomenon. I think it shows the response of people who have resources and have choice and privilege to make those, you know, decisions. But I don't think it really represents what most people in this country are actually dealing with day to day. You know, regardless, you know, somebody who might own a car, you know, what is that cost to a quality of life in this country if we can't provide better alternatives? You know, that's a huge financial commitment that a family may make in order to protect what they think is their health and their family, because they don't feel like there's a safer alternative. So I think it's very troubling. I mean, I see it happening, but I think it drives down to some deeper issues and questions that we have around what we're prioritizing as a country, the mixed messaging that we're getting around what is safe and what is not safe, and the lack of investment in making things like transit that so many people depend on do not have a choice to go out and buy that car. We're not investing properly in those choices for people so that they feel safe. So I think that's my reaction to that.
Thank you. We have a couple of different questions about specific programs. So we will follow up after the webinar with answers to those. And there's a question about, do we have copies of top complete streets ordinances across the country with information about each ordinance?
I shared, just sorry to interrupt, Walker. I did share with the chat, and I'm sure your team caught it. I shared the best complete streets policies of 2018, which I think is a good starting point for anybody who's looking for that kind of information. And then if they would like to dig any deeper, then they are welcome to reach out to the National Complete Streets Coalition.
Great.
And for all of CityHealth's gold medal cities, we also have their policies in place as well. So I'd be happy to share that language with folks.
And on the CityHealth website, under the policies themselves, you can find the language at the bottom of each policy. So you can see the exact language that we looked at in our assessment of each of these cities. All right, well, I think that we have come, oh, there's one question about age-friendly city planning initiatives and including aging people in complete streets policies.
That's a really important point, and that is something that we emphasize consistently and constantly around all ages and all abilities. I think that, you know, we really need to do our best to provide environments where people can age in place. We work very closely with AARP on these initiatives, and it's a fundamental consideration. Again, going back to the beginning of embedding it in a policy, so that it is part of your decision making all throughout the process.
Perfect, thank you. All right, well, I think that is all the questions. Oh, one more just came in. So we have, do you know what the updates to the standards referenced in the report coming out in 2021 will entail?
So I think that's a question for you, Emily, about your framework.
Yeah, we have released new guidance, and we've been working over the course of several years within the National Complete Streets Coalition to update our framework and our guidance particularly because we saw that there were some improvements that needed to be made in order to ensure implementation and more consideration and deeper sort of consideration of equity issues. So we have recently updated those guidance, the guidance and the policy framework. And, we're looking forward to working with CityHealth in the future on integrating that into their measure. But as we know, and this is one of the reasons that it was so important to include implementation into and a stronger push for implementation in the actual policy for complete streets policies, is because these things take time. So seeing a policy turn into practice is a matter of time. And so, we've been working for decades, really, on complete streets policies throughout the country. There's almost 1,600, 1,700 complete street policies on the books. And as we know, anything can be improved upon. So that is the work that we continue to strive to do, is identify places where we can improve and continue to improve. So we are excited about our new framework, and we're excited about working with CityHealth using that framework in the future.
Okay.
And as I had mentioned before, CityHealth does evaluate its policy package on a 5-year cycle. That's a process that we're undergoing right now. And so we are excited to continue working with Smart Growth America to figure out ways in which we can strengthen our criteria so that they do meet current best practices and account for all of the ways in which transportation is changing in the country.
Okay, and we had one more question come in. Are there complete street policies that have links not just to transportation infrastructure, but also around land use policies? Too often they get treated as completely separate when it's clear one impacts the other.
And we would argue that they go hand in hand. A complete street is to get you somewhere. Eventually, even if you want to spend some time on that street. So in the best case scenario, you would have complete street policy that works in concert with a land use policy or a form-based code or something along those lines.
And the only thing that I would add to that, and I think this goes back to some of the other questions around how do we really push city leaders if there is a lack of political will or if they're only focused on one thing. I think the more that you can draw the links between the intersections of these complete streets policies with land use policies, but other, public safety issues and things like that, the stronger case that you will have. So really just trying to draw upon the experiences of folks throughout the city and trying to link things like safe routes to school and complete streets policies or land use policies. I think it just makes for a richer discussion and really will motivate elected officials to pay closer attention.
Great, thank you, Katrina. All right, we are going to wrap up the Q&A. Thank you all for your great questions. Thank you to Emily and Katrina for answering everything. And I am going to turn it back over to Katrina to see us out.
Awesome, thanks Walker. And thank you again, Emily, for joining us and for all of you for all of your fantastic questions. There were lots of things that we need to follow up on, and we'll be sure to do that. If there are any city leaders on the call who are interested in advancing a complete streets policy, please feel free to reach out to me. We're happy to provide you with all of our resources. My contact information is here, and just thank you all so much once again for participating.
Thank you all.